There are some nutritional inputs that play a role in whether breast cancer occurs, whether it recurs. Sugar is a very hot topic in the area of cancer because there are studies showing that tumor cells preferentially utilize sugar for energy. You have a situation where the tumor cell can always take up more sugar and use it to grow, but your muscles, fat cells, and liver become resistant to insulin, the hormone that takes up the sugar, and that sets up the perfect milieu for tumor growth. So cutting down on sugar and losing weight are two things that might be very helpful for women with breast cancer. There have been concerns that soy might have enough of an estrogen-like property that it could cause breast cancer to grow. Over the years, the research has not supported that in humans. So where soy was somewhat controversial as a dietary component, we no longer consider it to be of concern. We constantly get asked, how can I eat carbs? We've done research showing that if you have a meal with vegetables, proteins, and carbs, if you have the vegetables and the protein first, followed by the carbs, you get much more gradual absorption of the carbohydrate than if you do it in the reverse order. And the net result of that would be to slow down the absorption, reduce the amount of insulin your body has to produce in order to absorb the carbohydrate. And when it comes to the weight gain potential, that would be reduced. And we prefer vegetables over fruit in the kinds of diets we use if we're trying to limit how much carbohydrate someone's consuming. So cruciferous vegetables like broccoli, cabbage, that's the type of vegetable we love women to have. And there are studies showing that if you increase the cruciferous vegetables in your diet, you can also reduce the risk of recurrence of breast cancer by 15%. So there are a lot of ways to approach the problem. There's no one way that's right for everybody.